Mark, schools have been empty now for months, though for those who've been able to persevere through virtual learning, well, the end of a challenging school year wraps up this week, and many families want to know what is being done to ensure a sustained return to in-person learning this fall. Today we had a wide-ranging one-on-one interview with Ontario's Minister of Education.
What is the plan for September?
We have committed ourselves to a full-time, in-class, more normal and safe learning environment, working in partnership with pediatric experts, including at Sick Kids, and of course, Dr. Moore, the new medical officer of health, who will be unveiling the full details for September in the coming weeks.
Ontario's Minister of Education telling CityNews that he's been working for weeks now with both the outgoing and now the new medical officers of health on a plan. Though today, teachers' union, speaking in a joint virtual press conference, had this to say.
Here we are once again, end of June, and it's just a complete deja vu to end of June last year with a minister talking about some magical plan that may come into play in July. And to date, none of us have been consulted on what actually needs to happen.
For the Delta variant in September in primary schools, this is a big problem.
Epidemiologist Colin Furness believes that if the majority of children 12 and up are vaccinated come September, the province must focus much of its planning efforts on elementary schools, where young students won't be vaccinated, noting that those children could lead to wider community spread of the virus if not monitored closely.
The big problem is the Delta variant predicts that there's going to be a lot of in-school transmission. So we can't use last year's data. We can't use last year's debate or last year's wisdom to say maybe schools are an issue, maybe schools are not an issue.
We are absolutely committed to refining our program to focusing on those schools and classrooms. We may not have the same vaccine rates as a consequence of the kids under 12 not being eligible.
Minister Lecce has repeatedly spoken about ventilation improvements underway in schools. The TDSB confirms to CityNews that due to government funding, they've been able to purchase HEPA filters for every single elementary and secondary school classroom. However, they note much of the ventilation work being done is part of the annual upgrades and maintenance. Furness believes more needs to be done, including a whole new approach to asymptomatic testing.
There's a recent test developed. It's a saliva test. It's a rapid test. Spit on the cup and 10 minutes later, if you have COVID. This could be done very easily in primary schools in the fall. So we're still doing enhanced cleaning. We're still looking at things like plexiglass and limited physical distancing and assuming or pretending that that's adequate, that that's sufficient. So I think the first thing that needs to happen is Ontario needs to catch up with the science.
I also asked Minister Lecce today if the province is considering making vaccines mandatory for those who are 12 and older who are hoping to return to in-person learning in the fall. He said that's not going to happen. They're not going to force anyone. They're just asking those who are eligible to get a shot to please get one. And again, he says that they're expecting to have a plan rolled out and in place in the coming weeks.